Hello everyone, thank you for joining me today. My name is Reanna Goodley from Fanshawe College. I'm excited to present the topic Food Insecurity, Adverse Childhood Experiences, and Food Insecurity in Early Childhood Education and Care. This presentation is part of our course Evidence-Based Practice under the guidance of Professor Jessica Phillips. Today, we'll explore how adverse childhood experiences and how food insecurity intertwine and impact early childhood development and education. To begin, let's define the Adverse Childhood Experiences Survey. The ACEs survey, developed by the CDC, is a tool used to identify the number and types of traumatic experiences individuals had before 18. These experiences include various forms of abuse, neglect, and household challenges such as domestic violence or substance abuse. Research indicates that higher ACE scores are linked to increased risk of mental health issues, chronic diseases, and behavioral problems. Disturbingly, about 64% of the U.S. adults report at least one ACE, while 17.3% report 4 or more. These experiences are associated with long-term health issues such as heart disease, depression, and even early death, leading to an estimated $748 billion annually in related health consequences in North America. Next, we must understand the social determinants of health, which are conditions in which people are born, grow, live, work, and age. These factors significantly impact health outcomes and contribute to health disparities. Social determinants shape overall health and well-being by affecting risks for various conditions, including chronic diseases and mental health disorders. They also contribute to the development of toxic stress, which has profound implications for physical and cognitive development. Key determinants include socioeconomic status, neighborhood and physical environment, education, social support networks, and healthcare access and quality. For instance, socioeconomic status influences access to resources like healthcare, nutritious food, and safe housing. Education affects health literacy and behaviors, while strong social support networks can improve mental health. The availability and quality of healthcare services also play a critical role in preventing and managing diseases effectively. Now, let's focus on food insecurity as an aspect of ACEs. Food insecurity refers to the lack of consistent access to sufficient and nutritious food necessary for healthy life. Research shows that significant association between ACEs and household food insecurity. Children who experience ACEs are most likely to live in a food insecure household, exacerbated by the vulnerability to poor health outcomes. Understanding this link is essential in addressing the multifaceted needs of children affected by ACEs and food insecurity. Food insecurity during early childhood can lead to developmental delays, cognitive impairments, and behavioral problems. These impacts are often mediated through stress and nutritional deficiencies associated with food insecurity. For example, children may have difficulty concentrating in school or exhibit behavioral issues, further hindering their educational and social development. Addressing food insecurity early can help mitigate these negative outcomes and support better development trajectories for affected children. Early childhood education and care professionals play a critical role in identifying and mitigating these effects of food insecurity. By providing stable and nurturing environments, ECEC professionals can help buffer the negative impacts of ACEs and food insecurity on children's development. Their role extends beyond education to include advocacy and support for children and families facing these challenges. For ECEC professionals, understanding ACEs and food insecurity is crucial for effective practice. Recognizing signs such as behavioral issues or developmental delays allows for timely interventions that can prevent long-term adverse effects. Creating a safe, stable, and nurturing environment in ECEC settings helps buffer the negative impacts of ACEs and food insecurity on children's development. Integrated services that address both educational and nutritional needs ensure a comprehensive approach to child development, while collaborative efforts with families and community resources build a support network for children. ECEC professionals also play a vital role in supporting families. Educational outreach can empower parents with strategies to create more supportive home environment. Facilitating connections to community resources such as food assistance programs and mental health services can help alleviate some stresses contributing to ACEs and food insecurity. Addressing these issues early can break the intergenerational cycle of trauma and poverty, leading to better outcomes for children and future generations. Building resilience in children and families fosters a more positive trajectory for their health and well-being. I chose this topic due to the prevalence and impact of adverse childhood experiences. With about 64% of adults in the U.S. reporting at least one type of ACE, understanding ACEs is essential for ECEC professionals who often observe these signs in children. The profound impact of ACEs on physical, mental health, academic achievement, and social development underscores the need for educators to be well-informed and proactive. Additionally, the connection to food insecurity is critical as it affects children's behavior and development through nutritional and family stress pathways. Enhancing educator awareness and training on ACEs and food insecurity can provide timely support and interventions, improving outcomes for affected children. Knowledge about ACEs and food insecurity enables educators to adopt trauma-informed care practices, creating a supportive and nurturing environment for all children. ECEC professionals play a crucial role in connecting families with resources and support systems, such as food assistance programs and mental health services. By fostering strong partnerships with parents and caregivers, educators can help build resilience in children and families, breaking the cycle of trauma and poverty. Addressing ACEs and food insecurity early in life leads to better health, education, and social outcomes, benefiting not only the individual but society as a whole. As we delve deeper into understanding food insecurity and ACEs, it's crucial to recognize how these issues manifest in real-life situations. This slide focuses on identifying behavioral and physical challenges in children, as well as parental and family indicators that can signal food insecurity. Children experiencing food insecurity may exhibit noticeable behavioral changes. According to Chen and Young, signs include increased irritability, fatigue, and difficulty concentrating. These symptoms can significantly impact their learning and social interactions. Additionally, Baden highlights that anxiety around mealtime, such as hoarding food or eating excessively when food is available, can be another red flag. Visible signs of malnutrition are critical indicators of food security. De la Huerva notes that poor growth, frequent illness, and physical ailments like dental issues are common in children suffering from inadequate nutrition. Furthermore, children may often appear tired or lack of energy to participate in the physical activities, which can, that's my ice maker, can often appear tired, lack of energy to participate in physical activities, which can be a sign of underlying food issues. Understanding the barriers faced by families experiencing food insecurity is essential for providing effective support. This slide explores the stigma and shame associated with food insecurity, access to resources, and economic constraints that hinder families from securing adequate nutrition. Families may feel embarrassed or ashamed to disclose their struggles with food insecurity, leading to underreporting and a lack of access to necessary support services. Cultural and social stigma around poverty and food assistance programs can further discourage families from seeking help. This stigma can be a significant barrier to addressing food insecurity effectively. Limited access to food assistance programs and services, particularly in rural or underserved areas, can hinder a family's ability to secure adequate nutrition. Additionally, complex application processes and bureaucratic barriers can make it difficult for families to access available resources. These obstacles must be addressed to ensure families can receive the support they need. Financial instability, unemployment, or low wages can severely restrict the family's ability to afford nutritious food, leading to a reliance on cheaper, less nutritious options. Additionally, related to healthcare, housing, and education can further strain limited sources, exacerbating food insecurity. Understanding these economic constraints is crucial for developing targeted interventions. Food insecurity and ACEs do not affect all populations equally. Certain vulnerable groups are disproportionately impacted. This slide focuses on children from low-income families and minority and marginalized communities. Children from economically disadvantaged backgrounds are disproportionately affected by food insecurity, which can exacerbate the risk of ACEs. Limited access to nutritious food due to financial constraints increase their vulnerability to adverse health outcomes and developmental challenges. Addressing these issues is vital to support these children effectively. Racial and ethnic minority groups, including African American and Hispanic communities, experience higher rates of food insecurity in ACEs compared to their counterparts. Systematic inequalities such as poverty, discrimination, and the lack of health care contribute to the heightened risk faced by these populations. Recognizing and addressing these inequalities is crucial for creating an equitable support system. Continuing our discussion on vulnerable populations, this slide highlights challenges faced by children with disabilities and immigrant and refugee families. Children with disabilities are at increased risk for experiencing both food insecurity and ACEs due to various factors, including limited access to support services and health care. Physical and cognitive impairments may hinder their ability to access nutritious food and protective environments, exacerbating their vulnerability. Tailored support is essential for these children. Immigrant and refugee families often face multiple stressors, including language barriers, cultural adjustments, and economic instability, which can increase their risk of food insecurity and ACEs. Limited access to social support networks and unfamiliarity with available resources may further exacerbate their challenges. Providing cultural sensitive support is key to helping these families. Food insecurity and ACEs have effects that span across a lifespan. This slide explores the impact on childhood development and adult health outcomes. Food insecurity and ACEs during early childhood can have a profound and lasting effects on physical, cognitive, and socio-emotional development. Impacts may include poor academic performance, behavioral problems, and compromised mental health outcomes. Early intervention is crucial to mitigate these effects. Adverse childhood experiences, compounded by food insecurity, increase risk of chronic diseases, mental health disorders, and substance abuse in adulthood. Persistent stressors from childhood can contribute to the range of health disparities and socioeconomic challenges across the lifespan. Addressing these issues early can help improve long-term health outcomes. Early childhood education and care professionals have a vital role in addressing food insecurity and ACEs. This slide discusses the importance of early identification, support, and creating nurturing environments. ECEC professionals play a crucial role in identifying signs of food insecurity and ACEs among young children under their care. Early detection allows for a timely intervention and support services to mitigate the negative impacts on child development. Being vigilant and proactive is essential. ECEC settings serve as an important environment for promoting positive interactions and relationships, which can buffer the effects of ACEs and food insecurity. Cultivating supportive and nurturing environments can enhance children's resilience and coping mechanism, fostering healthy development. This is a key aspect of the ECEC profession. Continuing from the previous slide, we will now discuss the role of ECEC programs in providing nutritional support, education, and collaboration with other organizations. ECEC programs can offer nutritious meals and snacks, addressing food insecurity and promoting healthy eating habits among children. Providing nutrition education to families can empower them to make healthier choices and improve security within the house. The dual approach is crucial for long-term impact. Collaboration between the ECEC professions, healthcare professionals, community organizations, and is essential for addressing multifaceted needs of families experiencing food insecurity and ACEs. ECEC professionals can serve as conduits for connecting families and resources such as food assistance programs, mental health services, and parent support groups. Building these networks is vital for comprehensive support. Preventing food insecurity and ACEs requires a multifaceted approach. This slide explores the preventative measures at various levels, utilizing the social economic model as a framework. So I decided to make this slide to explain what the model was to help with my next one. The social ecological model is a theoretical framework that explores how individual behaviors are shaped by interactions at various levels of the environment, including interpersonal, organizational, community, and policy factors. It emphasizes a reciprocal relationship between individuals and their environments, providing insights for interventions aimed at promoting health and well-being. So the individual level, factors such as knowledge, awareness, attitudes, beliefs, and perceptions influence participants' behavior, which in turn shaped by the individual's physical and social environments. At the community level, features of the community including convenience, cultural attitudes, transportation, availability, and neighborhood safety influence participant retention. Interpersonal level involves participants' interactions with family, friends, healthcare providers, and all which play important roles in participant recruitment and retention. The public policy level shaped by local, state, and federal laws, plays a significant role in the socio-behavioral and biomedical research. The organizational level, rules, regulations, and the general attitude towards research within healthcare institutions impact participant engagements. Organizational support can include providing resources, fostering cultural research, and ensuring that administrative processes are streamlined to participation. Alright, so these are the examples. So for the individual level, one of the most effective preventive measures at the individual level is educating parents on nutrition and budgeting to maximize their food resources. By providing parents with the knowledge and the skills to make healthier food choices within their financial constraints, we can help them ensure their children receive a nutrition they need for optimal growth and development. Workshops, informational pamphlets, and one-on-one counseling sessions can be utilized in part with this crucial information. For the community level, partnerships with local food banks, farmers markets, and advocacy groups can be instrumental in providing access to fresh and affordable food. These collaborations can help bridge the gap between families and nutritious food options, which may otherwise be inaccessible due to geographical or financial barriers. Community gardens and local food drives are additional ways to support families in need, ensuring that fresh produce is always available to everyone. At the organizational level, particularly early childhood education and care centers play a vital role in combating food insecurity. Implementing food programs such as a breakfast and lunch club within these centers can ensure that children receive at least 2 nutritious meals a day. Not only aids in their physical health, but also enhances their availability to focus and learn effectively during the time at the center. At the interpersonal level, building supportive networks among families in the ECEC community is another key strategy. By fostering an environment where families can share resource and information, we can create a safety net that supports everyone involved. These networks can facilitate the exchange of surplus food, recipes, and cooking tips, as well as providing emotional support during challenging times. At the policy level, on a broader scale, advocating for policy changes to increase funding for food assistance programs and improve access to nutritious food is essential. By influencing legislative action, we can create a systematic change that benefits all families, particularly those facing food insecurity. Policies that support subsidized health food options, enhance food stamps programs, and school meal initiatives can help make a significant difference in alleviating food insecurity. Alright, so this is the case study I've come up with surrounding the Patel family and food insecurity. The Patel family, originally from India, immigrated from Canada 10 years ago and settled in a community in London, Ontario. Mr. and Mrs. Patel both are in their early 40s and are dedicated parents to 2 children, Maya, age 6, and Arjun, age 4. They are fluent in English and deeply value their cultural heritage, which they have actively passed on to their children. Mr. Patel works as a full-time accountant, while Mrs. Patel is a part-time teacher's assistant. They both have bachelor's degrees. Recently, the Patels have been facing issues of food insecurity despite their best efforts. They struggle to afford nutritious food on their limited budget. Rising costs, unexpected expenses, and challenge for providing the growing family have contributed to their financial strain. The family lives in a neighborhood with limited access to grocery stores and fresh produce, exacerbating their struggle to obtain healthy food options. The Patels have been affiliated with the local early childhood center for the past 3 years, ever since Maya started preschool. They actively participate in parenting workshops and community events organized by the center to help support families facing similar challenges. However, accessing food assistance programs have been difficult due to their eligibility criteria and scheduling conflicts around Mr. Patel's work hours. Despite their hardships, the Patels remain resilient and committing to providing the best possible upbringing for their children, and they are hopeful that this supportive community and access to resources, they can overcome their current challenges and hope for a brighter future for their family. And this is a summarized version of the case study, highlighting all the key information to help with whoever chooses it. A little cheat sheet. So for the conclusion, what did I learn about the ACEs and the social determinants of health in general? I learned that ACEs have a profound and lasting effects on health and well-being, with implications for childhood development and adult health outcomes. These experiences are influenced by social determinants of health, such as household food insecurity, which can be exacerbated, I can never say that word, with negative impacts of ACEs. What did I learn about food insecurity? Specifically, I learned that food insecurity during early childhood can contribute to behavioral problems and developmental challenges, highlighting the interconnectedness of nutrition, family stress, and child development. This underscores the importance of addressing food insecurity as a social determinant of health to mitigate its adverse effects on children. And what will it take with me from this learning to practice as an early childhood leader? In my practice, as an early childhood leader, I will prioritize interventions that address social determinants of health, such as promoting access to nutritious food and providing support for families experiencing food insecurity. Additionally, I will advocate for policies and programs aimed at reducing ACEs and mitigating the long-term impact of children's health and well-being. And this is my reference page. All images are from Canva, all videos are from Canva. Thank you for spending the last 21 minutes and 30 seconds with me. I hope you liked it. Thank you. Bye.